Talk about SockIt oral hydrogel wound dressing used with graft procedures, and specifically talking about soft tissue grafts. SockIt used with graft procedures provides drug-free pain relief, protects from contamination, and it helps to optimize the healing process. SockIt's easy to use, however, it is important to follow these simple instructions. Perform graft procedures exactly as you normally would. Apply SockIt gel to the periosteum just prior to placing the graft. And after you suture the graft into place, then apply more SockIt gel to the graft site. And here's a picture of the SockIt gel being applied to the graft, a labial graft on number 24. If you're doing an autologous graft, be sure and apply SockIt to the donor site. Of course, that's a particularly sore area, and it's a wound that needs to be dressed and taken care of appropriately too. Send the SockIt syringe with the remainder of the gel and the patient instruction sheet home with the patient. And just put the syringe and the instruction sheet in a packet for the patient to take home. The patient should apply SockIt every 4 hours or so to protect the areas from microbial contamination and growth and to promote optimal healing. If you're using a removable stent, the patient may easily remove the stent, clean it, dry it, and apply a gel to the appropriate area and then replace the stent, and that will carry the gel to the affected area easily. And of course, the patient may apply SockIt as often as needed for pain relief, every 4 hours or so to redress the wound, but more often if needed for pain relief. And remember to encourage the patient to continue to apply SockIt to the sites every 4 or 5 hours or so until the syringe is empty, which usually takes about 3 days or so. When used as directed, SockIt safely provides constant pain relief without numbness. It protects graft sites from contamination, both chemical and microbial, and it helps to optimize the healing process. And here's a photograph with complete healing on the area around tooth number 24. Very nice result. And that's all there is to it. If these simple instructions are followed, you and your patients will be very pleased with the benefits provided by SockIt and graft procedures.